I still have nightmares. I still can hear the people's cries.
Inside this Winnipeg long-term care home, Eddie Callisto Tavares says she witnessed horrors that will never leave her.
My fear was that every time I stepped outside of my dad's room was what's happening to all the other residents.
Seniors, she says, were locked in their rooms, ignored, terrified. Her only comfort, caring for her father, Manuel Callisto, in his final moments. So many others, she says, were left completely alone.
It feels more like a prison than a home.
The system failed the residents who died. The system failed the residents and employees who got infected.
So far, long-term care and retirement home residents account for 56% of the country's COVID deaths, more than 15,000 people. And though the pandemic clearly exacerbated the problems in Canadian care, many issues have existed for generations.
We have actually been able to see the conditions that seniors are currently living in and have been living for the past decades.
Experts say it's time for the federal government to show leadership in the form of national standards and oversight.
The federal government does have power to look after the health of the nation. And so it could use those powers if it wanted to do that.
Justin Trudeau has promised national standards before, but another year into the pandemic, there's been no action out of Ottawa.
We're now starting to see the deaths mount again. And what it tells me is that when we haven't fundamentally fixed some of the issues, we're just going to keep seeing repeated issues of outbreaks.
Samir Sinha, a world-renowned geriatrician, has been preparing recommendations for long-term care standards. Smaller settings that feel more like homes, one person per room, a ban on shared washrooms, and at least 4 hours of daily care per person. Scandinavian countries, particularly Denmark, he says, are ahead of us when it comes to compassionate, safe living spaces for seniors.
They started saying, let's do what we can to support people in their own homes for as long as possible, because that's often can be done at half the cost as what it would cost to care for somebody in a long-term care home.
In Winnipeg, 56 people died during the outbreak at Maple's personal care home. Today, new residents are being accepted again. Callisto Tavares worries we haven't done enough to avoid more unnecessary death.
This is still happening. There's still people crying out for help, and there's no one there to help.
And why the need for lasting solutions in these homes remains as urgent as ever. Jamie Mauracher, Global News, Toronto.